Today we're going over troubleshooting the bench press. So when you have a patient that has shoulder pain in the gym, particularly with bench pressing, I'm going to show you how to modify that lift so they can continue working towards their fitness goals. And if you choose the right exercise, what's kind of cool is that you're going to help them be pushed out of pain and get them back in the gym where they want to be, all right? So the first variable that we're going to talk about today is modifying load, okay? So when folks have pain in the bench press in the gym, usually what they don't tolerate is heavy weights, okay? So I can't tell you how many times I've had a patient come in and they tell me, you know, bench press hurts, right? But bench press doesn't really hurt until they get above, let's say 80% of their 1 rep max, right? So if they're doing sets of 10 to 15, things end up feeling pretty good. But when we go up to sets of 5 and that load goes higher, 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 oftentimes they have a bit of a challenge and they can't really tolerate that, right? So what I tell my athletes is that, hey, if we blow through this pain, there's a chance that things get better over the course of time. There's also a good chance you can aggravate this further and maybe make the injury worse, right? So I think the smartest thing for your patients is we modify their gym training so the training is very tolerable. And from a pain perspective, I like to have that pain below, let's say a 3 or 4 out of 10. The other thing to keep in mind is that when athletes are using these modifications and they feel pretty good while they're training, we want to make sure that that night and the following day, they don't feel terrible, right? So if you do a bunch of bench press in the gym, it feels great, but the next day you feel god awful, there's a chance that what you did in the gym the day prior was a little bit too much, okay? So the first thing you can do to modify the bench press in the gym when folks are having pain is going to be to change the load by changing the amount of repetitions that you're doing, right? So if you're doing sets of 5, you have to keep the loads pretty high, right? If you're doing sets of 1, obviously it has to be very, very high, okay? But if you're doing sets of 15, then that load is automatically going to drop because your 15 rep max is automatically going to be a little bit lower than your 1 rep max, okay? So let's say you have an athlete and they have a cycle of, let's say the next 4 weeks, they're planning on doing sets of 5, and the following 4 weeks doing sets of 3s, okay? And when you start to assess their shoulder, like this thing is aggravated, I don't think these 5s are gonna be a good idea. What we can do is bump those reps up to 10s, and maybe the following month you're doing sets of 6 to 8s, right? And the other piece is that you can kind of progress athletes as fast as they're tolerating the movements that you're throwing at them. It's not like the following month we have to do sets of 8s. You might be back to 3s the following month. You might be feeling pretty dang good, all right? So step 1, your shoulder is hurting in the gym, okay? And you're trying to continue bench press, consider increasing the repetitions, right? So if you're doing sets of 5, try sets of 10 or sets of 15, okay? The second way we can modify load in the gym is going to be by changing the tempo, okay? And this can be either by going a little bit slower on the way down, on the way up, or adding a pause, right? So let's say if your shoulder's hurting you for sets of 10, right, during bench press in the gym, and I say, hey, let's pause each repetition at the bottom of each lift for 1 second and 1 second at the very top. What automatically happens is that your athlete has to take some weight off the bar. Just because now there's more time under tension, it's more challenging to complete the exercise, so we take a little bit of load off, right? Oftentimes this is great because if someone is load intolerant, they're able to get a nice training effect, right? If you're a powerlifter, you have to train the pause anyway. It allows us to continue working towards our goals, not aggravating the area further, right? And choosing a good movement that's probably gonna help to rehabilitate the shoulder, okay? So tempo as well as pause reps are really helpful for that, okay? And the last one that's really helpful is to change the rating of perceived exertion, okay? If you've never heard of rating of perceived exertion, or RPE, it's basically how hard you feel like a set is on a scale of 0 to 10, okay? So 10 out of 10 is basically, you got in a car crash, right? And then someone is underneath of the car and you have to pick up that car and you're gonna push as hard as possible, all right? 0 to 10 is like nothing, all right? I think the majority of folks in the gym, their sets are somewhere between, let's say, a 7 and a 9 out of 10, all right? So let's say you're in the gym, your shoulder is hurting, your patient is hurting, and when they get to those 8 or 9 out of 10 sets, the shoulder starts to be aggravated. What I can do is program them to be doing RPE 7 or let's say 8 out of 10. What's kind of cool is that you automatically decrease the load, so someone who has a load intolerant shoulder is going to feel a little bit better, right? And if you look at some of the literature we have on training to failure versus getting close to failure, so if they take 2 groups of people that are strength training, this group trains to failure on every set, and this group leaves a few reps in the tank, and they strength test before the study, and then they strength test again at the end of the study, what they find is that the improvements in strength are very similar, okay? So if you have a patient with an irritable shoulder that's really pushing things and going to failure all the time, then you can actually reduce that RPE. Oftentimes you make the movement more tolerable and it feels pretty good, and you're probably still working towards strength and hypertrophy at the same level as pushing to failure. what I recommend first, if you have a patient that has shoulder pain in the bench press, the first thing you should try to do is modify the load, okay? So that could be slowing the repetitions down, maybe that's increasing the reps. If that's not effective and the patient is still not able to bench press in a way that feels tolerable or pain that's less than a 3 or 4 out of 10, the next step that I usually do is try to change the grip, okay? So imagine I'm bench pressing with a bit of a wider grip. If I go more narrow, a couple things happen. For one, you change the elbow position. So you see that my elbow gets a little bit closer to my side, okay? And what that does, it probably changes some of the stress within the shoulder, right? And the other piece is that as I take my grip closer and closer, I'm probably increasing the contribution of my tricep and decreasing the contribution of the shoulder. So if you take someone that has shoulder pain, you go wide to narrow, oftentimes you can really decrease the pain, okay? The other thing you can attempt to try, and this is something I'd try after you tried a bunch of other things because it's kind of a weird movement, but you can go from overhand grip here, right? So pronated and think about where my elbows are here in this movement, and I can go to an underhand grip, okay? Now if you notice what occurs from this grip here to this grip here is I really change the angle at my shoulder, okay? So we do have some research that shows if I change my grip from here to here, I will change the structure that's in my subacromial space that may be getting compressed, okay? So when I bench press, one of the most common injuries you can have is some sort of injury, or irritation to the rotator cuff or the biceps tendon, okay? So if I go from here to here, I change which structure is being stressed, okay? So if I've overused this position, if I go here, I might end up feeling a little bit better as a result, okay? So if you have a patient that has shoulder pain in the gym, first thing to try is modify the load. If that doesn't work, the next step would be to change the bench press modification. So going from, let's say, a wide grip to a more narrow grip, and you could potentially try to use an underhand grip as well, okay? A narrow grip is probably decreasing some of the stress in the shoulder and increasing some of the tricep utilage, right? So we're now putting a little less stress in the shoulder, a little bit more work for the tricep and the elbow. And if you use an underhand grip, we're probably changing the stress in the shoulder, potentially by moving the stress away from the rotator cuff and onto the biceps tendon or vice versa.
To go along with this video, I have a really nice guide for you today. It is the ultimate guide to getting out of shoulder pain. We go over 5 keys to learn so you can get your patients out of pain and back in the gym. Number 1, we'll teach you the basics about shoulder pain in the gym. Number 2, we'll go over modifying lifestyle and training so we stop irritating the joint and allow it to rehab. Number 3, we go over identifying and correcting mobility limitations that may be continually irritating the shoulder when you're training in the gym. Number 4, we go over correcting technique issues in the overhead press as well as the Olympic lifts. Number 5, I'll teach you how to gradually load the shoulder through a progressively more challenging strength program. This guide is 100% free. I'm going to leave a link in the description in the show notes. Go ahead and click on that and download it now.
So by implement, I mean going from a barbell to something like a dumbbell, okay? Just like that. Now, first and foremost, I think the reason why transitioning from a barbell to a implement like a dumbbell is so effective for folks is because a lot of folks don't tolerate a lot of load, okay? And a lot of folks are trying to push weights on the bench press. So it's very common to see sets of 3, sets of 5 prescribed in a bench press program, but you probably don't see sets of 3, sets of 5 in a dumbbell bench press, okay? So oftentimes people tell me like, hey, you know, dumbbell bench press feels A-okay, but barbell bench press doesn't feel okay. And it's probably just because with dumbbells, we don't use as much load, right? The other thing to think about is that dumbbells are inherently a little less stable. So when you're bench pressing with dumbbells, you have to be able to stabilize those weights. And because of that, you probably can't use as much load as well, okay? So if you can't tolerate bench press well and you want to choose an implement, the first one I recommend is trying to bench press with dumbbells, okay? The other thing that's really nice about a dumbbell is you can modify the elbow position very easily. So you can bench press with dumbbells out wide like this, okay? Or you can take them in this way and bench press here, all right? And whenever we alter the position of the elbow, we're probably altering the stress on the shoulder. And if we go from, let's say here in a bench press, doesn't feel good, and we take our grip a little more narrow for the dumbbell bench press, we're probably offloading some of those irritated structures in the shoulder. Plus, as you go closer with your grip, we're increasing the contribution of your tricep as well. So first thing I recommend trying is going to be the dumbbell in terms of modifying the bench press by implement. The second one you can try is using a neutral grip bench press, okay? Or excuse me, bar. So we're using, I think this is the American bar from Elite FTS. This bar is phenomenal because you can change your grip to be wider or more narrow. And the other piece is that we can change your grip from being more pronated to more semi-supinated, right? So a little less of that pronated position. And if you'll notice, if I go from this position here, straight bar, and I go a little bit more supinated, right? More neutral position, watch what happens to my elbows. They drop a little bit, okay? And as we talked in the last episode, right, the last video, we talked about changing the elbow position and changing the stress within the shoulder. So if you have, let's say, rotator cuff related pain and you're always bench pressing out wide, if you go a little bit more narrow or you change the grip slightly, that might offload the rotator cuff slightly in a way that you can continue bench pressing without as much pain, okay? So your shoulder's killing you, try the dumbbells. If that's not working out really well, you can use a specialty bar just like this, okay? And to be honest, I would probably recommend using a specialty bar first. It's just that most gyms don't have this. So I'd say try the dumbbells, right? But if you have access to an American bar like this, phenomenal bar from Elite FTS, try that first, okay? And again, our goal is to find a pressing modification that's tolerable and doesn't make your shoulder feel like garbage the next day, all right? So if you're using a flat bench and the flat bench is painful, one of the first things you can try is inclining, okay? So when I am doing an incline press this way, think about what happens within the shoulder. So if I'm doing a flat bench press and I'm pressing, the angle is straight ahead this way. But as soon as I go on an incline, I have to get my elbows underneath the barbell and press more an upward path, okay? And what's happening in this situation is I have to go into relative external rotation, okay? And what's interesting about the shoulder joint as well as the rotator cuff is that when you spin the joint this way, you actually move the rotator cuff with it, okay? So oftentimes when you start pressing overhead, when you have pain pressing horizontally, you might think more stress in the shoulder, that's gonna make it worse, but you actually might be offloading some of the structures that are getting overworked when you're doing flat bench, all right? So when you have pain in the bench press, you can attempt to modify the angle by doing a slight incline, okay? The other piece is you can always do more or less incline, all right? You don't necessarily have to go, super steep, but I would recommend trying what is most similar to the movement you're trying to improve, the bench press. So I wouldn't incline it really high at first. I'd incline it a little bit and see if that helps with your pain, okay? So we tried to incline the bench press, and let's say that wasn't successful. The patient is still hurting, your client is still hurting a lot. You can also try a decline, okay? So I don't have a decline bench set up, but I wanna show you what's happening when you do a decline bench, right? So let's imagine I have a decline bench right here, and it hurts to do a flat bench press, like so. If I start to decline, all right, so imagine I'm on a decline now, a couple things happen. So for one, the bar is going to touch my chest sooner than if I was flat. I have to go a little bit lower, okay? So look at the angle of my shoulder deep in a bench press versus in a decline press, I don't have to go quite as deep, okay? And when you change the range of motion requirement, that might reduce some of the stress on the shoulder that's giving you pain in the first place. So it's worthwhile to give that a shot, okay? And the other piece is that we talked about a regular bench press, we have the elbow right underneath of the hands, and when we go on an incline, we have to modify that slightly, okay? The same thing happens with a decline, all right? So my shoulder angle would be here for a regular bench press, and as I go into a decline, it actually changes a little bit. So you might be in a bit more internal rotation. And for that reason, this movement might be much more tolerable than a regular bench press, okay? So I'd recommend first trying a little bit of an incline. If that feels tolerable, great, let's go with it, let's load it. If that's not feeling great, you can also try a decline and see if that helps you out a little bit.
1, 2, 3.
What I'd like to talk about next is modifying the range of motion that you use in your bench press. Oftentimes, if we limit the range of motion, we can automatically decrease some of the pain in the shoulder and allow someone to train comfortably, right? So they can keep on working towards their fitness goals, right? And if we choose the right exercise variation, let's say a partial range of motion press, it might be a perfect rehab exercise to help that person get out of pain and back to training, right? So there's a lot of options that you can mess around with, okay? So the first of which is super simple, is that you just reduce the range of motion that the barbell travels, right? So if I am setting up for my bench press, like so, I unrack and come all the way down, you can see just how deep the elbows get, right? But if I'm only going through a partial range, let's say I'm doing something like a spoto press here, you can see I'm more at 90 degrees at my elbow and my shoulder. I'm not going quite as deep here, okay? So in certain pathologies, I think the big one is probably going to be some sort of AC joint pathology or shoulder instability, especially anterior instability. Going through that very deep range of motion at the very bottom might be pretty provocative. But if we cut that range of motion, we might be able to train nice and heavy, right? Continue with our sets and reps without having changing much besides just how deep that you go, okay? So the first thing you can try is cut that range of motion, maybe pause here and press back up again. There are a lot of other ways to cut the range of motion as well. So here are some of my favorites. So you can either do a board press, which at least for me was popularized by the late Louis Simmons. You take a 2x4 and sometimes multiple 2x4s, you know, 1 board press, 2 board press, 3 board press, and place this on your chest so that when you're bench pressing, come down, touch the board, and press back up again. So you can also use a towel. So I'd say a big towel rolled up so you have a decent amount of space. And this is actually a hip thrust pad, and you can also take this and just put that in your shirt. So when you go back to bench press, you know where you're headed, right? So I can unrack pretty easily, come on down, tap the pad, press back up again. That way I'm nice and consistent with my repetitions from rep to rep, and I don't have to guess, okay? The last way where we can cut the range of motion is by putting pins set up in the rack. So we have some pins, you can't see them right now, but you can put them in the rack. Let's imagine I have them set to about here, and I set them up so when I come down to the bottom of the bench press, the barbell will rest on those pins for a second, and then I press them right back up again, all right? So again, you're very consistent from rep to rep. You're always hitting that same height. For folks that have an irritated shoulder, oftentimes all they need to do is eliminate this little bit of range of motion, and the top range feels phenomenal, and you can train that and get a lot of benefit from that without aggravating the shoulder further, okay? So when you do a bench press, we will pin the shoulder blades back and down, all right? This is usually because you're trying to raise your chest up and reduce the range of motion so you can lift a little bit more weight, okay? So when we do a press, you have a contribution from the shoulder joint as well as the shoulder blade, okay? So normally when you press, we have what's called protraction at the top of the motion. So you're getting relative retraction as the bar comes down, and when you press away, you're getting relative protraction, okay? Except normally in the bench press, we don't allow that to happen. We pin those shoulder blades back and down the entire time, usually because we're trying to lift a little bit more load, okay? One of the things you can do is increase the usage of the shoulder blade or the scapula during common movements, okay? So during a landmine press, during a push-up, and also a band push press, you're freeing the shoulder blade to help out the shoulder. So basically, if you're not tolerating the bench press because the shoulder's doing too much work, we can get the shoulder blade to help a little bit, okay? So let's first go over a landmine press. So there's a lot of different variations you can use. If you perform a landmine press standing, the movement is a little bit more straight ahead, all right? So think about pushing in a bench press is straight ahead. If I do this in a half kneeling position, you can see how I'm more overhead now, all right? So I'd like to first start in this plane, but you can also try half kneeling, see if that feels any better for the shoulder. And when I do this movement, you can see bar comes all the way down, I get retraction of the shoulder blade, and as I press away, I'm actually reaching. I'm trying to utilize my shoulder blade and a little bit of my torso to get this bar moving, all right? So my shoulder is hurting. If I add the shoulder blade, a little bit of rotation from the torso, I might be able to get away with training with less pain. The same thing goes with a push-up. So when I'm doing a push-up, as I lower towards the floor, I get relative retraction of my shoulder blades, and as I press away, I start to get protraction of the shoulder, all right? So if I have pain in the bench press and I'm doing a push-up, coming down, I'm letting my shoulder blade do some work. And when I get to the top, the shoulder blade is actually working a little bit more. So oftentimes, if the bench is really killing me, I can actually get away with either some landmine press or some push-ups. The last variation I like to try is going to be some sort of band or cable punch press. And I actually really like the cable better, but just because we're filming, I'm going to show you a band. But really, you would just take the cable stack, bring it up to shoulder level, then you put a single handle on it, put whatever weight in the pin, and then walk out. And from here, we have a square stance. You can obviously do this split, half kneeling, whatever you like. And from here, I rotate a little bit so I get a little contribution from my hips as well as my core, and I press, and you'll notice I'm trying to reach a little bit at the end. So I'm allowing my shoulder blade to do a little bit more work as well as the rest of the chain, okay? That tends to be a little bit helpful for folks that have pain. The other piece is that the landmine press as well as the cable punch press is a little bit unstable. Whenever you have a movement that's a little bit less stable, oftentimes you can't use as much load. Now, if you have a patient that has shoulder pain because the load is too heavy and they're load intolerant, and using one of these movements automatically reduces that load and it can allow you to try to, continue training with less pain, right? Because at the end of the day, we're trying to find a variation that replaces the bench press, allows people to continue working towards their training goals, and also allows that injury to heal and get better over the course of time, all right? So when I do a press, I unlock my elbows and I start to come down. And for folks in shoulder pain, it's usually the press that hurts. However, if you lock out the weight, that tends not to hurt these folks, okay? So you can often get away with movements where you're stabilizing something in front of you, but as soon as you start to press, it starts to get aggravated, okay? So if that's the type of patient that you're working with, and oftentimes these movements work really well. So the first crawl variation we'll go over, and probably my favorite for folks who have pain, is gonna be a backwards crawl, right? So we start in a bear position here. I'm gonna push away from the floor, knees come up in the air. Oftentimes we wanna make sure this feels good. This is actually a pretty good exercise for folks if they have some shoulder pain and they're very irritable. But if we're tolerating this well, we wanna make it a little more challenging. What we can do is start taking steps backwards. We start with small steps, we can work our way to larger steps over the course of time, okay? Now, if you think about a crawl variation, what we're doing is basically this, right? That's the whole thing we're doing over and over and over again, okay? And this is not the same as doing the whole press. We're actually getting the active motion at the shoulder blade that we want. Because when we press, we have to come all the way down, but at the very end, we have to protract and upwardly rotate a little bit with the shoulder blade, and we're actually training that quite a bit, right? The other piece is that when you lock your arms out and hold a plank, you do get a little bit of shoulder work, you get a little bit of pec work, but not much, right? But the idea is that eventually we want to get back to pressing, which is going to use a lot of pec and a lot of delt. So doing a crawl variation allows us to get a little bit of work to the pecs, to the delts, a lot of shoulder blade work, which you know is helpful for folks in shoulder pain, so you can actually work a little bit towards their training goals, right? And simultaneously rehabilitate their shoulder pain as well, okay? The next crawl variation I like, if the backwards crawl is not going well, is gonna be a side-to-side crawl, all right? So same setup, hands and knees just like this. I press away from the floor, this is protraction, my knees pick up, and I take small steps to the side, okay? And I can just go back and forth, 5 to 10 steps per direction, per side. And the idea is similar, okay? I like pushing backwards because I think that's a little bit more work for the serratus anterior. Side to side is not quite as much, but you still work the musculature around the shoulder blade, which can be really nice for shoulder pain, okay? Now, if crawl variations are going poorly, you can try a shoulder tap, okay? So you start in a push-up position, feet a little bit wider to maintain your balance. You want to pretend like there's a glass of water in your lower back, and you don't want to spill it, okay? So you don't want to rock your hips a ton while you do this. And you pick up one hand and tap the shoulder, okay? Back and forth. And lastly, if the shoulder tap is just not being tolerated really well, you can just incline the height. So imagine me doing that same shoulder tap, but against the wall versus on a bench versus all the way on the floor. So if you do that movement against the wall, super duper easy. You go down to a bench, it gets a little harder, and you get down to the floor, it also feels a little bit more challenging, all right? And the last thing you can try with the shoulder tap is just protraction. So I'm here, sink the shoulder blades, all right, together, right? So chest sinks through the shoulder blades, and then you push away from the floor, okay? So at least we get a little bit of protraction work, okay? So guys, if you have a patient in a ton of shoulder pain and it hurts most with bench press, and you try all the modifications and nothing works, you can try some of these crawl variations or shoulder tap variations to push the needle forward, right? And as soon as someone tolerates a pressing exercise, we want to start pushing them that way, okay? So that's it for today's video, but it's not it for your learning. So if you're a coach or you're a clinician, you're trying to troubleshoot pain and injury in the gym, get people out of pain and back to training, click on this video right here, continue the learning. Once again, my name is Dan Pope. I'm a physical therapist. I'm going to help you get your patients out of pain and back to training. I'll see you on the next video.
1, 2